Welcome. Thanks for tuning into The Good Nurse Outlook, a podcast about life from a nurse's point of view. But if you're not a nurse, that's okay too. Not only will I discuss things nursing and healthcare related, but everyday matters as well. Honestly, the topics are endless. I'm your host, Nurse Naj. Let's get into it. Hey, you guys. Welcome to the Good Nurse Outlook podcast. My name is Naja. I'm an ER travel nurse. Thank you so much for tuning in. If you are following me on YouTube, please comment, like, share, and subscribe. If you're listening to me on Apple Podcasts, Anchor, please again share, comment, subscribe, and leave a comment. I love engagement. I've been doing review of the weeks. So today's review is from episode 5, Self-Reflection, and it comes from Johanna, who commented, "This is great! Exclamation mark, exclamation mark. So many people have felt this way but can't admit it. Exclamation mark. You are giving a voice to those who are still searching for theirs. Exclamation mark. Go Naj. Exclamation mark." Thank you so much, Johanna, for the comment. That is like so nice of you to say. So, on today's episode, we will be discussing being a new nurse in nursing. And this goes for anyone who's like LPN to RN and now you're transitioning to an RN role. This message is for new grad RNs, people who are switching specialties, or maybe you're leaving home care, IV therapy, skilled nursing facility, rehab, and you're transitioning to a hospital or a different setting or specialty. Regardless of your background history, when you enter into a new field, specialty, facility, etc., you're going to be the new nurse. So recently I visited my per diem job and it was full of, I keep calling them student nurses. It was full of orientee nurses. One of the girls was like, "Oh, well, I was the LPN and I just got my RN, so I already know." Now, I love and respect everybody, but please, and I know they talk about that in that LPN to RN track. Don't come in with that mentality like, "Oh, I'm an LPN, so I already know." No, come in with that, "I'm happy to be here. I'm excited to be here. Thank you for showing me. Can I help you?" Come in with gratitude, grace. If you come in with that nasty attitude or like that "I know it all" type of attitude, or "I have some experience, so I'm better than the next," at least I was the LPN. This girl's straight out of RN school. Like, no, you guys are the same now. I just want to say that because I don't like that. And whether you've came from like skilled nursing facilities or whatever, it's not the same as the hospital. In smaller facilities, you can cover up so much. I've been around, so I know some things, but I'm just saying. But in a hospital, you can't get away with some of the stuff that you were getting away with at other places. So in the message, I will be referring to all the umbrella of nurses that I mentioned earlier as a new nurse. You're gonna be a new nurse wherever you go. If you left one place and you come into another place, you're new. So the message of today's topic is being a new nurse in nursing. Let me be honest, it's going to be hard. You're going to feel overwhelmed. You're not always going to know what to do. Even me, like switching from RN to MP role, I'm not even really ready for that transition yet. I mean, I'm confident and everything like that, but I know I'm going to be like at the bottom toting pole. Is that what they call it? Oh, y'all, look at my sleeve. Hey. I know I never really showed off because I'm always cold in my own house. I know. Ooh, look at that. I don't really know how well it's showing. And I have one like up here. Okay, sorry. My bad. Yeah, it's not gonna be easy transitioning as a new nurse because you won't know policies, procedures. You'll be unfamiliar with the layout, unfamiliar with people. You may not know where to park or how to get your lunch or different things. Hopefully, you bring lunch. I don't know. According to a recent study, over 50% of nurses quit within the first 5 years. More specifically, over 17% quit within the first year, and 56% quit after the first 2 years. This issue has also been exacerbated by the COVID-19 pandemic, where 95% of nurses have reported feeling burnt out within the past 3 years. I know those statistics are like, wow, I'm a new nurse, and now like statistics are showing that I may not even make it. But don't worry, you're gonna make it. You're gonna be fine. COVID-19 pandemic was just something totally different There wasn't enough nurses. Everyone was fearful. A lot of people were expiring. It was just a lot. However, by the grace of God, we're all very thankful that those times are gone and we're on to better times. I would say the plus side is, though, you didn't have to orientate during the pandemic. So, that's a plus if you're a new nurse right now. It was rough for y'all. I ain't gonna lie. So let's dive into it. You're a new nurse and you're searching for a job. Get the job you want. I remember being in nursing school and we were preparing to exit and take our NCLEX, and the instructor was like, "Oh, you're gonna have to start in med surg if you want to be an ER nurse, and if you want to be a specialty nurse, you always need to start in med surg." Like there are some professors that are like med surg, med surg, med surg, med surg. Like they're pounding med surg into your head, and that's simply not true. You do not have to start in med surg if you don't want to be in med surg. Why start somewhere where you won't even be happy at? So now I'm trying to give you all the tools in this episode to properly prepare yourself, and you start on a unit you don't even want to be at. That's like a you have in one ear your instructor is saying start on med surg, and then you have your family or your bills, honey, telling you, listen, you start wherever you get a job at. I remember I was a new grad nurse, graduated from the affiliated nursing school, and I applied and I didn't get accepted. And I was like, oh. So I spent a year at the skilled nursing facility because I was already a CNA there. And then I applied again for the job and I got it a year later. Don't give up. Even if you don't get your dream job, of course, go for your dream job, go for your specialty. Look into new grad nurse programs because many hospitals do offer that. Even search up new grad jobs. Although I wouldn't like make that my only search, right? I would search for new grad jobs and I would just search for RN jobs because honestly, even some of them will say you must have a year experience. Apply anyways. Listen, just flood all that. If it's the specialty you want, you never know. I do not believe that you need to start on med surg before you go anywhere else. They have boot camps or programs for specialty areas. I feel like it's even better when you do apply to those programs because if you start on med surg and then you want to be ER, like it's so different. You need all these different certificates. You have to learn about critical care. You have to learn so much more than what MedSurg prepared you for. I can say MedSurg does prepare you on time management, prioritizing your patient, and how to work under stressful conditions because literally you probably have 6 to 8 patients, and some of them can walk and meet you at the nurse's station and be all up in your face, and then you have the family members who are walking for the ones that can't walk. So it just becomes a whole lot of stuff. Go after what you want, get the job that you want, and don't let sign on bonuses distract you either because at the end of the day, if you're somewhere you don't want to be and it's because you got a sign on bonus and you're like, this 5K gonna look good in my account, and then you're miserable when you go to work, it's just not worth it. And a tip that worked for my sister, who's a registered nurse, was that she was looking for a job and not a lot of people were hiring for new nurses, and she was finding a very difficult time. So what she do? She went out and got her ACLS, she got her BLS, and she got IV certified. And then she took another course, which I forgot what it was. She got all these courses up under her belt because it was very competitive in Florida to get her license. So she had to make herself look attractive. And honestly, that was so smart. If I'm HR, I'm looking at two RNs and they both just graduated. They're both similar in age, race, whatever. I don't know. I know they're not supposed to look at those things, but you know. And let's say this one has ACLS, BLS, IV certified, but she's a new nurse. She got a lot more going on than this one who just walked out of nursing school and asking for a job. And I feel like when you don't have a job and you're taking those additional courses, it gives you time to really dive into it, really understand the process and how everything goes because in nursing school, probably feel like everything was crammed into you and that you just had to memorize. And now you're like, okay, I got time to actually breathe and understand the process. I highly recommend that. So, number one, get the job you want. Number two, prepare ahead of time. Let's say you have the job you want. You're a new nurse, you're on the unit, you're starting. Be prepared ahead of time. And what do I mean by being prepared? Be on time. Be early, actually. When I was a new nurse, I was always early. I'll show up 15, 20 minutes early. I did start on med surg and I would have 6 patients and I would have to know what was going on with each one of those patients. And I was like so new. I didn't know how to read an H&P. My preceptor at the time, she was like impatient. She didn't have time for me and my questions. She tried, but you know, If you know her, you know her. Get there early, not necessarily. I know some facilities have something like, oh, don't punch in or whatever. Fine. Get there early, don't punch in, but don't touch no patients either and don't accept report. Read ahead. If you are punched in, go in the rooms, look at your patients. If they're awake, hi, good morning. My name is, I'll be your nurse today. May I see your IV? I always checked IVs, especially as a new nurse. I did not know how to put in IVs. So I would be walking around with flushes and the night nurses thought I was crazy. There has been so many times where the IV's just hanging or like the fluid is not really connected and it's dripping. And then I'm gonna be stuck with that on the day shift. Plus we have rounds and so many other meetings. It's just like, Before you try to give me this report, I'm gonna need you to fix that IV. Thank you. This is like more experienced nurse, but it's something you could bring to your preceptor. Hey, the IV isn't working. Now your preceptor, she may just put the IV back in or make that a moment of training with you. But when I was off orientation, that's how I was rolling. I was like, and I'm not good at IVs. I was checking IVs. But when I had my preceptor, I brought it to her attention and was like, hey, the IV is not working. And then you know what? That also prepares the night nurse. Oh, I got to give a report to Naja. Let me go make sure these IVs are working. Perfect. Now we all good. Check running medications, write the names down. So let's say you didn't even go to the computer to check your patient. Another thing I like to do is I would bring the WOW. I was like, me and the WOW workstation on wheels, we were connected at the hip, honey. If I was going to room 3, the WOW was outside of room 3. You're there, you saw your patient, you checked the IV, you see medications running, scope out the scene. Like, okay, there's nothing that the patient can fall, the side rails is up, the bed alarm is on. Let me throw this away, empty the urinal if it's full. I know it may seem like you're doing a lot, but let's say you don't have no tech or you have two techs and then the techs are doing vital signs and the patient wants to pee and you're trying to chart. Okay, now you got to go back and empty that when you could have just did it in the morning. People think I'm crazy sometimes, but also people wonder how the heck can I be done with my charting, be done with med pass? How do I get so much done and I'm relaxing like mid shift? And I don't want to say relaxing, but depending on the day, I'm usually relaxing. Why? Because I am ahead of the game. And as a new nurse, that's what you want to do. You want to anticipate needs. And it's not something that's taught in nursing school, but it's something that you need to learn. You need to be thinking, how can I make my day easier for me as a new nurse? You know, you have blood sugars that need to be done at 11 o'clock. Try to get your med pass done by 10, squeeze some charting in, 10:30, start your blood sugars. Don't wait till 11 o'clock. What if something happens? When you have time to do something, do it. Don't wait. Oh, I don't have to pass meds until 12. I'm going to do. No, because you never know what's going to happen. Another thing, round on your patients. Just because you see your preceptor or another nurse or whatever, if you see them sitting down and barely going in the room, you're not going to be that nurse. You're going to be the nurse that's always checking on your patients. Always, hi, you need ice water? No problem. I'm telling you, anticipating needs. You know, the patient is always pain seeking. Hi, your morphine is due at 2. I'll see you then. You don't have to ring. I won't forget, okay? And then you leave. I'm telling you, you make your day smoother by being prepared. And I know that was a lot and it was very advanced, but I'm telling you, you're going to get there. Also, when you're in the room with the patient, note any oxygen, any tubing, anything that you see fully catheter. Okay, the patient has an NG tube. So when you're getting a report from the nurse, make sure she's hitting these points. That's how you be prepared. That's how you stay on top of your patients. Always have your stethoscope. Unless you're working somewhere where they're not checking breath sounds or abdominal sounds or heart sounds, always have your stethoscope. I don't care if it's on your side pocket or if it's at your nurse's station, but just keep it near you. Always have a stethoscope, keep scissors on you. Some of these medications are so hard to open, the packet, like magnesium and potassium. I don't know who's stealing these hot topic items. Pens, more than one for sure. Have a notepad so you're able to write down things. If you learned a new medication or write down a new policy, procedure. Let's say you had a fall and there's different steps you need. If you have a discharge and admission, I know it sounds like a lot and it can be overwhelming, but if you have a notepad, you have a reference. If you have a reference, you won't need to bug your preceptor and you won't have to deal with her feeling frustrated like, are you even listening? So wrinkle-free clothes. I've been seeing a lot of nurses come into work just wrinkles and I'm just wondering like, why? And comfortable shoes. You're working for 12 hours. I've seen people come in with like Balenciaga shoes. I don't even know what they are. I'm not that hip, but comfortable shoes, okay? I like Brooks, you know, hookahs, whatever it's called. They give me vertigo. I don't like those. Another thing with being prepared, Know where to find supplies, suction tubing. Let's say there's a code, know where the crash cart is, know where you can find IV kits, blood tubing, and know what med rooms have narcotics and which ones have IV antibiotics. On to number three. Set realistic goals for the day. Like, I'm gonna write my name on the whiteboard. I know it's annoying, it's frustrating, but imagine you're the patient and you're disoriented, confused, or you're new, or maybe it's change of shift and you don't want to be like, nurse, nurse. You could be like, Naja, Naja, because you know my name and I wrote it on the whiteboard. Also lets the visitors know when they come in, like, wow, the person was attentive. Oh, we see the plan is to get out of bed. Oh, great. We see that the patient is NPO for surgery. Like, those things matter. It's annoying to do, but it's not annoying if you do it early in the morning while you're rounding on your patients. As a new nurse, when you see your patients, write your name on the board. You're preparing yourself for a better shift. Another realistic goal. I'm going to pass my meds at 8:30. I'm going to be done by 10. As a new nurse, you're going to be task focused. Your critical skills are not going to be up there. You're going to be like, okay, I know this has to be do, this has to be do, this has to be do. And you're just looking at dot, 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 dot. Check, 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 check. You have to kind of step out of that. Also, say to yourself, today's going to be a great day. I'm a registered nurse. I wanted this. This is what I wanted. Set realistic goals for the day. Even when you're in the day, set goals. A realistic goal would be I will prioritize my patients appropriately. Also, just say affirmations to yourself. I am a new nurse, but I'm doing the best I can. Affirmations is what got me to where I am now because I absolutely love, love, love affirmations. They are so helpful to me. Ta, 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 ta. Okay. Number four, be friendly. Don't whine and don't complain. There's nothing worse than a new grad nurse or a new nurse who's on the unit. Ugh. Oh, wait, let me see. Ugh. Okay, I don't complain a lot, but unless I'm pissed off. Yeah, there's nothing worse than a new nurse on the unit. Y'all got six patients? Oh no. I don't have enough time to do it. I can't do this. Or just feeling like overwhelmed and becoming like very chaotic. Like, we get it, you're new, and we are here to help you. And if you don't feel like you're being helped on your unit, my apologies. Probably not the best unit, but still learn what you can, get what you can from that experience, and then try to move on and then move on, maybe. I don't know. If you feel like you aren't being helped, then I would go to my manager and ask for another preceptor because at the end of the day, it's your nursing career, it's your nursing license, and maybe that person isn't set to be a preceptor. Maybe they just want to work and go home. And that's not the person that you need to be precepted by. Nurses on the unit are probably experiencing burnout and compassion fatigue, and they have to deal with you. And not to say that in a rude, disrespectful way, but a way to combat that is being friendly. I'm telling you, even the grouchiest nurse is not gonna pass up you doing her blood sugars for her. If she is, shame. But again, realize I'm a new nurse. I don't know much, but I'm here to help. Speak to everybody. Hey Ash. Hey Anna. Hey Sue. I don't know. There were like 3-letter names. I've been doing that a lot lately. I don't know what that's about. Offer yourself. Listen, as a new nurse, you may come across some free time. Let's say you've been on the unit for a while, you're doing well with your ratio of patients, your charting is getting done, your meds are getting done, you're still in orientation now, you're still new, but let's say you have some free time. Hey, Sue, you need any help? I could do your blood sugars. The more you offer self, when it comes time for you to need something, people are going to be very willing to help. As a new nurse, I was very afraid to do IV sticks, but I would do butterflies and I would do finger sticks for other nurses. And I would even like change their patients during your free time that you may have if you've passed all your meds and you're charted and you don't have anything to do yet or at the moment. And you see another nurse is putting in IVs, or maybe she's doing a Foley catheter or NG tube insertion or something that you've never done or never seen, even suctioning. Participate in that. Hey, do you mind if I watch? Oh, can I see this? No nurse is going to turn down an extra pair of hands. Number five, go home and review. Go over things like how to use the Zoll defibrillator because as a new nurse, you may encounter a code and you go get the crash cart and someone tells you to put the pads on and you're like, I was just trying to bring you this. I'll document. I'll do compressions. Like, that was me. I was a documenter. I'm trying to help you not become me. I was very scary as a baby nurse. But those are things you can look up on YouTube or how to run a code. You could check that out on YouTube. CPR, we check pulses every 2 minutes, compressions. If no one's in the room and I have to bag, how should you bag the patient? I know when we take these courses, sometimes it's like a speed by, drive by, you forget it the next week. And that's why it's very important. In your little notepad, write the procedure down and just review it. Go over it every now and then. Also, understand like the medications that's needed in the code: epi, mag, calcium gluconate, etc. And also look up how to give report, because as a new nurse, you're not gonna know how to give a very nice report like you are gonna be given too much information, and the nurse is gonna be like, what needs to be done? Some nurses, like me, I just want to hear what the patient came in for, their diagnosis, what are pertinent labs and diagnostics, and the plan. Everything else I can look up. 5 years ago, the patient had his appendix taken out. No, no, don't overdo it, new nurses. And hopefully, you have a preceptor that kind of guides you. You want it to be very nice flow. Patient came in with complaint of right lower quadrant pain. CAT scan showed appendicitis. Patient is currently MPO. Plan is for OR per team. They called and stated it'll be at 1600 hours. Patient is to remain MPO, something like that. And any pertinent labs, white blood count is elevated. Patient last payment was, I know, I'm good, y'all. I know. Damn, look at how she give report. Oh my gosh, she's the best nurse ever. Yeah, look up things in your spare time when you go home. Look up how to give report. Buy chart like a boss so you know how to document well and save your butt and save your license. Review your notebook. Look up unfamiliar medications. Even watch videos on how to call an MD. Practice with a colleague. My preceptor Maria, oh, Maria. Oh, I was almost spilled her whole last name, child. When I was getting off orientation, she was so sweet. She met with me at Starbucks and we reviewed everything. We reviewed like how to do a code, discharge, admission, if this was to happen, etc. And I think that is so important. But if you don't happen to have that at your facility and you're a new nurse, write the things down and just in your spare time review, or find a nurse that you feel comfortable talking to and say, hey, do you mind if I go over this with you? Even like if you're a day nurse and then you run into a night nurse and maybe the night nurse is a little bit more friendly, share your questions with her. Also, learn how to manage stress and manage your time and prioritize. As a new nurse, you're going to feel overwhelmed, overworked, underpaid, undervalued. If you know how to manage your time, manage your stress, do the things that are important first, but also remember anticipating needs, because it is so hard for someone to trip you up or throw you off or anything if you haven't anticipated the needs, right? You got this pain seeking patient, just have the pain med ready. They won't bother you. That's one less thing you got to worry about. And number 6, brush off bad shifts. Focus on being better than yesterday. Learn to laugh at yourself and don't beat yourself up about things that honestly won't matter a few weeks from now. As a new nurse or a transitioning nurse, you're going to say things, do things, and even embarrass yourself. But it's how you handle it. Don't be afraid to apologize, admit you were wrong, or admit that you don't even know something. There's no shame in that. You're not expected to know much, if I'm being honest with you. As a new nurse, no. People say all the time that nursing school does not prepare you to be a nurse. And as I do believe it gives you the foundation, it doesn't prepare you for scenarios such as family members yelling at you, or having 8 patients and 4 is really sick and 2 are walking to the nurse's station yelling about why you haven't gone downstairs to get their Uber Eats. I mean, those scenarios are not in nursing school. So we experienced nurses, we don't expect you to know it all. But we do expect you to try, be willing to do things within your scope of practice, to be professional, to be on time, to be polite. Like those things we are expecting of you. Most nurses work 312s, other nurses work 5 8 hours, and then other schedules can vary. Ultimately, you have a bad shift or if something goes wrong, just brush it off, man. I have an episode actually, how to cope after a bad shift. And I highly recommend that you watch that because it's going to help you navigate those feelings and those emotions, but don't carry that into your next shift. As a new nurse, fortunately and unfortunately, the learning does not stop once you pass NCLEX. Honestly, the adventure just begins. And your experience in nursing is going to be a wave. You're going to have good days, you're going to have bad days. Some days you're going to be like, wow, I had such a really great day. Just hold on to the good moments, hold on to the good memories, hold on to why you became a nurse, and just understand, listen, this is part of the process. It's going to be a little frustrating. I'm going to be a little annoyed, but it's all about how you handle yourself in situations. In conclusion, As a new nurse, you are going to come across many challenges. You're going to learn a lot. You're going to cry a lot. I'm just kidding. I hope you don't end up crying. There's going to be different experiences that you have during nursing. And I believe if you hold on to these 6 tips and the stories that I shared, you are going to be fine. You are going to make it. If you are a new nurse, how are you liking nursing? Like, do you find it difficult? Do you have any tips or any suggestions that's helping you right now? Are you an experienced nurse who remember when they was a first year nurse or a new nurse? Let me know. Till next time. Mwah. Bye. And thanks so much for tuning in. God bless.